Today, I am delighted to speak to my friend and colleague, Deepa Kannan. She is the author of How to Sleep Better. This is a 10-step protocol based in Ayurveda and functional nutrition to support you and your patients with sleep quality. So today we're going to be talking about her book, how you can integrate principles of Ayurveda, and what that even means. If you're not familiar with it, you'll learn a lot today. But we're going to talk about how you can integrate all of this into your clinical practice with your patients. If you're a physician who wants to uplevel your sleep medicine knowledge, then go ahead and subscribe to this channel and keep learning about clinical sleep medicine. I'm Dr. Nishi Bhopal. I'm a physician specializing in integrative psychiatry and sleep medicine. And before we jump in, I'd like to invite you to get my free melatonin brand guide. Many of our patients are taking melatonin, but quality concerns are a big consideration. So you can learn more about that and third-party tested brands in my free melatonin brand guide. You can get that at intrabalance.com/melatonin. Okay, so let's jump in. I'm really excited for this conversation today, Deepa. I love your book, and I'm really excited to share this with people because as physicians or healthcare practitioners, especially here in the West, I'm in the US, there's so much emphasis on pharmacology for sleep issues. Yet we know that sleeping pills are just one piece of the puzzle and aren't all that effective. So there's so many amazing tools in this book. So please introduce yourself to our audience, and then we'll get into talking about the book.
Thank you, Nishi, first of all, for having me. And I love your channel and congratulations on the 10,000 subscribers as we record this conversation. And my journey in wellness started about 25 years ago with teaching yoga. So I've been immersed in yoga teaching, living in the ashram, and way before yoga became popular. So at those days, friends would look at me like, what was I doing with my life? And was yoga teaching something people really do? So I've been in this for a long time. So sometimes I just think I'm a dinosaur in that world. And along the way, when I had my son 15 years ago, and he was born with this adrenal disorder called salt wasting congenital adrenal hyperplasia, where the kids don't produce or they don't have the genetic code to produce cortisol and aldosterone. So, without steroid replacement, they dehydrate, they lose sodium, and they die. So he was diagnosed just a few hours before we lost him. So he's steroid dependent, and that I think was the start of my journey into understanding adrenal function. And I didn't even know what was the adrenal gland at that point. So it was a lot of education back then. There were not many websites which spoke about this condition specifically or even the adrenals. Today there's a lot of talk about cortisol and the role of cortisol in both how our body functions on a daily basis, as well as just in the role it plays in the creation of any imbalance and disease. So this is how my education primarily came from, looking at my son and learning from that. Along the way, when I started to ask his endocrinologist, because he would have so many crises and go into the ICU, and they would require high dose of steroids just to get over a simple fever or a stomach bug. And I asked, does nutrition play a role? Does food play a role? Because he's having so many crises. And the doctor said to me that food has nothing to do with this. And that, of course, was the aha moment where I started to study nutrition, and then by fluke came into this world called functional medicine, and started to study functional nutrition, which is nutrition based upon the principles of functional medicine. And then, of course, in functional medicine, there's a lot emphasized on three core pillars required for all healing, which is sleeping, eliminating well, and blood sugar balance. And the sleep recommendations was generic. It was to tell people that to be able to heal from any chronic condition, that you need to have good sleep in place. But nobody was really talking about how each of those sleep challenges might be unique in themselves. And it wasn't as simple as telling everybody that sleep is vital. What does somebody do who's really struggling with sleep? And then I felt intuitively that there was a lot of complexity, and I also started to hear about functional medicine practitioners mentioning that certain protocols were not evidence based. And I know we'll talk about this because it's very important that we do. But at that point, I thought back that when I started teaching yoga, there was hardly any research on meditation, on the benefits of meditation. And fast forward 10 years later, there's a lot of it. And meditation is being utilized as a tool, even by doctors, even by those who are very science centric. And for sure, it's taken a while for that research to catch up. So that just got me thinking that everything may take a while to reach that level. That doesn't mean it may not have relevance. So I just felt that Ayurveda would complete the circle, because obviously yoga and Ayurveda are sister sciences, and one without the other felt a little bare. So when I studied Ayurveda, it did feel like I was coming back home and completing that circle. However, there were some Ayurvedic colleagues who would talk about, if a patient asks them, what do we do when we have high cholesterol or high homocysteine, that they would say no, labs existed thousands of years ago, just ignore them. And that was not a good approach as well, because I think we shouldn't have polarity in this science and ancient wisdom. We need to be able to integrate them seamlessly and create synergy, where we are giving our patients the very best care possible and allowing for a large toolbox, so everybody can take what resonates with them and utilize it in a way where they can restore the balance. So that's my quick journey into these three worlds. And today I integrate all those, which is what I've done in the book, How to Sleep Better. And the reason, Nishi, just quickly to close that introduction, is that Ayurveda says there are three pillars to health, which is Ahar, Nidra, and Brahmacharya, or the right food, sleep, and the right sexual conduct, where you're not suppressing nor are you overusing, because they do believe that the sexual fluid is linked to our ability to have optimal aging. And there's a lot spoken about today in terms of longevity. So there was this common aspect that both these worlds had three pillars of health, but the common one was sleep. And that just highlighted how that synergy between these two worlds does cross over in the language of sleep, and how vital sleep is to all of us for good health and to get over disease.
Thank you for that introduction and sharing your story. And I think it's very powerful to hear your own health journey or the health journey of your son and how that really inspired you to take a deep dive into this field. And now you're helping so many, thousands and possibly millions of people now with your podcast. Deepa is also the host of the Sleep Whisperer podcast, so everybody can check that out as well. And then she's also written this book, How to Sleep Better. And you've done a really beautiful job of integrating Ayurveda and these ancient principles with modern functional medicine. And I just love how you've laid it out in terms of the 10 senses. And so we can talk about that a bit more. But for anyone who's listening, some of our listeners may not be familiar with Ayurveda and what that means. And even functional medicine, I think it's not really well known yet. So could you just explain what is Ayurveda and then what is functional medicine?
Beautiful. So I think Ayurveda is Ayurveda literally means the science of life. So it gives you the information or the knowledge that is required for all of us to be healthy. There are certain principles that we need to understand to really understand Ayurveda as a whole. And that is the belief that while science looks at the body as various systems, organs, Ayurveda looks at it as a particular combination of the five elements, which is air, space, fire, water, and ether. And they're not esoteric concepts. I promise you, we're going to just talk about them even from a perspective of science. But just to get us started, that it's believed that these elements come together in different ways to form three energies, which is called Vata, Pitta, and Kapha. So, air and space come together in the body as Vata, fire and water come together as Pitta, and earth and water come together as Kapha. Now, these three doshas can be a friend or foe. A friend when they come together in a particular combination in each of us, which decides our unique constitution. And three come together in a particular way at the time of conception based upon the state of the mother and the father's doshas, and they decide, will we be thin, will we have a large bone structure, will we have a tendency for certain state of digestion, will we have a certain temperament, are we more prone to anxiety, anger, depression, what are the diseases that we might be predisposed towards to. So this state which is unchanging but decides our constitution is called prakriti. So, by understanding each of our unique constitution, we almost have a blueprint or a code as to how should we live, because Ayurveda then scripts out based upon the different constitutions what will tip us off balance, what will restore the balance, what are the symptoms that we'll have when we're off balance. And there can be many constitution. There can be predominant vata, predominant pitta, predominant kapha, vata, pitta, kapha, or dual constitution where one is predominant, the second is secondary, and also where somebody is very rare and has all three in perfect balance. So that's the prakriti, and there's a concept called vikriti, which is the present state of imbalance, where when you assess somebody right now, they could have imbalance in any of these doshas, vata, pitta, or kapha. So if there's vata imbalance, you'll have sleep challenges, you can't fall asleep, you'll toss and turn, very light sleeper because vata is air, so everything will be light. Our nervous system will not be grounded. So we'll have the vata controls the nerves. So think of vata as everything that's responsible for all movement in the body. Food that moves to the GI system, waste that moves out, the in communication that moves in the nervous system, communication which moves in the endocrine system. All movement is controlled by vata. Pitta is everything that's transformation, where whatever is required, converting food into energy, converting nutrients into hormones. So, everything that is responsible for transforming something, heat is required to transform. All that is transformation is controlled by Pitta. All that is stability and building structure, the ability to build and form our skeleton, our muscles, all things that require stability is controlled by kapha because it's earthy. So when somebody has sleep issues in Ayurveda, the kapha people with a lot of earth and water, they're the ones, because kapha, the upper region of the body, which is the chest, the throat, and the head, when in excess, it will lead to increased mucus in the back of the throat. So they'll have diagnoses such as sleep apnea. Because there's too much of mucus building, and then when you lie down, it closes the airway. That's the kind of sleep diagnosis that will occur for kapha. In pitta's imbalance, it will show up as being fiery, so they'll have sleep challenges disrupted by symptoms such as hot flashes, estrogen dominance, and vata is so light that they just won't fall asleep. So the majority of sleep challenges is driven by vata in Ayurveda, and anybody can have vata imbalance. We're living in a world which is highly vata imbalancing, and why I say that is that vata is the, while pitta controls the eye, vata controls the movement of the eye, and it is said that when the eyes move, it becomes a doorway to imbalance our nervous system. So the faster our eyes move, the more the nervous system gets imbalanced. And living in a world where we are constantly stimulated by movement and scrolling in social media, all of this is vata imbalancing. So it makes our nervous system ungrounded. So that's a little bit about Ayurveda. I don't know how deep we should go. You could feel free to ask me if we have to go a little deeper, but that's the basic understanding of it, that there's a Prakriti, a unique body constitution, a Vikriti, which is a present state of imbalance. We do need to assess somebody for both to really understand how we can target efficient, personalized therapies to restore sleep in that person. Functional medicine is a lot of people in Indian functional medicine. I've heard the statement that functional medicine is the modern Ayurveda, and I would agree in some ways that functional medicine also believes that the body systems are interconnected, that it's taking away from the allopathic approach where you go to a gastroenterologist for one thing, the hepatologist for the liver, the endocrinologist. So generally you can have patients who are going to endocrinologist, cardiologist, neurologist, hepatologist, and none of them are speaking to each other. So functional medicine is the system that is whole. It's a medical system where doctors are understanding that it's relevant and necessary to go into these connections and address the body systems as a whole rather than isolated parts. It also uses very high level testing in the form of gut microbiome analysis or heavy metal toxicity, understanding what's going on in the body and utilizing the information from high level testing to then understand how to personalize protocols for everybody. So that's a little gist of Ayurveda and functional medicine.
Thank you for that overview. And it's really helpful to hear how Ayurveda conceptualizes these different types of sleep issues, because those are all common issues that those of us in clinical practice are working with. Insomnia, middle of the night awakenings, maybe from hot flashes, sleep apnea. And so we'll talk more when we get into the book about different approaches for these sleep issues from Ayurveda and functional medicine. Before we even go into that, I'd love to hear your thoughts on the evidence base, because this is something that I will hear about frequently, especially I'm in the Western medical system. And so it's all evidence based medicine. And so, how would you explain that to a Western trained clinician who said this stuff isn't evidence based, even functional medicine? There's a lot of around that in some arenas. So, could you speak to that? And for the clinicians who are listening, they want to practice evidence based medicine. So, how can they integrate some of these other principles in an evidence based way?
I think that's a beautiful question, Nishi, and something that is extremely relevant in today's world. And as I said right at the start, that I do, because I have my feet in these two worlds, I see at times there can be polarity. And I think polarity is a word that's also symbolizing a lot of what is occurring in overall health today, because in the world of marketing ourselves as health practitioners, we can be guilty of polarizing and separating people. And I think that's a dangerous trend in itself. So for me, it's always been about synergy. So, how can we integrate and how can we utilize so that we give the patient the best experience? So, just to start us off with that, and I think it is understandable because everyone has been trained in a particular way and therefore they're looking at the world from that lens. So if there's a Western trained clinician or a researcher, they're absolutely going to be looking at it from that perspective, and therefore it can be new and sometimes daunting to take several other perspectives. So I just want to get started, and I wrote about this in the beginning of the book as well, about research and how my goal was to serve the patient in the best way possible. And at times, research can also be contradictory. We do know this concept of confirmation bias, where we can go out and look and find certain studies to validate what we are practicing in. There can be conflicting studies as well. So it's important to keep that at the back of our mind. I do also want to say, though, that there is a lot of improvement in this, and I see very specific Ayurvedic journals. There are a lot Ayurvedic Vaidyas and their teams who are focused on doing research into Ayurvedic principles and understanding, so that it can be more accepted globally. And I think that's important work that is being done. If you do look up research on Ayurveda, there's a lot that comes up today. I think that's wonderful. And the same thing goes back to what I was telling you right at the start about yoga. So while we may not have said it's a yogic tool, there is research on meditation. Similarly, if we do not say Ayurveda, but we can find research to say oil massage lowers cortisol and boosts oxytocin, that doesn't mean it's not Ayurveda. So I think this ability to sift through that information very subtly is also required. That we might not always find it if we go looking with the word Ayurveda, but what about the practices in themselves? So that's something we need to keep in mind. That said, as I said, there's a lot of Ayurvedic research out there today, and it is increasing. So there is a lot of studies on sleep itself from the perspective of Ayurveda, and practices where they've gone into exploring the benefits of studies of practices such as yoga nidra. I know that there are two sleep researchers in India who I know, and they are presently working on some studies, sleep studies, and analysis of patients based upon the efficacy of yoga nidra as a tool in helping to improve sleep. And my request always to people who are focused in that area is to, this book has so much of the practices. Please try some of those and try to validate them, because obviously we can get more people using tools which are non invasive and which do not come with adverse side effects, if there are more people who are in the field of research who are devoted to doing this work. So I think we're a long way off before everything can catch up, for sure, but it begins with every sleep researcher and every person immersed in the world of sleep research having an open mind and taking some of those protocols, maybe for a while, just trying it on themselves, and just know that we're all here to improve sleep in the world. And keeping an open mind is what makes us learn new things, and then we can contribute to it becoming more validated in the world out there.
Wonderful. That was such a wonderful explanation. And I just love how you emphasize let's look at the practices. Let's look at the practice of massage, of meditation, of breathing exercises, and how do those impact our physiology? How do they impact sleep? What's the research? And that's how I got interested in Ayurveda actually when I was in my psychiatry residency training. I was struggling a lot with burnout, with anxiety, sleep deprivation, all the things that we deal with when we're in our medical training. And that's when I discovered yoga and meditation. And I experienced how transformative those practices were for me, but I wasn't learning about them in my medical training. And I thought there's a real disconnect here. These practices are helping me with my anxiety, but I'm not learning how to use them with my patients who I'm treating for anxiety. And so for me that kicked off this kind of exploration into yoga that led into Ayurveda and then integrative medicine and then a whole host of other things, functional medicine and so on. But let's jump into your book. How to Sleep Better, and it's based on a 10 cents. Could you tell us about that? And then maybe we can start looking at what practitioners can take away and start using. But what's the 10 cents protocol all about?
So, Nishi, and I know this is something which is a new concept in itself, because I've had a lot of practitioners who've interviewed me and asked whether I created the 10 senses myself. The texts of yoga and Ayurveda, ancient texts, talk a lot about something called 10 indriyas, which are the 10 senses. The five jnana indriyas are what we are familiar with: sight, sound, smell, touch, and taste. And then there are these five karma indriyas, which are the senses of action. So there are also five of them. So the rectum is something that we look at as detoxification. The genitals perform the action of sexuality, urination, procreation. So there's a hormone sleep connection. Then there's legs, which allow us to have locomotion. They get us from place to place, movement. Then there is our hands, which allow us the ability to grasp and hold, which I've explored in the concept of pain and sleep, and how there's a connection there, which we'll talk about shortly. And then, of course, the mouth, which performs the action of speech. So we can go in quickly into all of these. I used it as a framework to bring this synergy between science and ancient wisdom. So I didn't want to talk about it only from the perspective of yoga and Ayurveda. I used it to talk about the science of those systems as well, which is what I've written about in the book. So, in the sense of sight, we all in sleep know the connection between light and sleep, but I explored a little bit about how the health of the eyes plays a role in our ability to regulate circadian rhythm. And Ayurveda does talk a lot about the eyes, both from two perspectives. The first is there's a pitta on the surface of the eye, which, when in excess, causes inflammation to the eye, which is the beginning of all eye challenges, which also impacts circadian rhythm or our ability to use light in the right way. But again, we spoke about vata in the beginning, that the movement of the eyes and how quickly we move the eye can play a role in how we imbalance or balance our nervous system. So when somebody has a lot of vata excess, which is nervous system being predominantly fight or flight, they will have a tendency to scroll social media very quickly. So they'll move on a remote control of a television so quickly. So you will get to understand how they are by the way, how rapidly their fingers and eyes are moving. They express what's happening in the nervous system. So I used it to explore the whole science of sight and light. In the sense of sound, I understood that the ears are the home of Vata dosha. Now it's very beautiful that I found when I started to practice something called Karna Purna, which is putting warm sesame oil into the ear canal. It was as if I'd switched off my nervous system. That very night, I would have very deep sleep, and had my mind been chattering away for the last 1 month, it was as if it had been switched off. So I started to wonder, and that's when I realized that the ears are a home of vata. And when there's high vata in the region of the head, we can have overthinking, the inability to switch off our mind, the inability to fall asleep. And vata is in excess becomes dry. So anything where we bring unctuousness, and we use the ear canal to add oil into that ear, nose, throat region. And we know from science that the nerves are all surrounded by a fatty sheath. And when we just restore unctuousness to these areas, the nerves start to perform in a balanced way, the way they're supposed to. So I explored sound as a connection between adrenal function and the nervous system and this vata connection. And then smell, when the excess kapha, because kapha's home is in the chest and there's a lot of sinus here, Let's say somebody has the tendency for sinus congestion, it means they're going to have a default mouth breathing. And we know research has told us today that mouth breathing shifts somebody into a sympathetic dominant state. It reduces nitric oxide production, it increases heart rate, breathing rate, it increases core body temperature. So, all of this is not conducive to sleep. So, obviously, we require somebody to be having an ability to breathe through their nose. So, unless we clear those areas, how can you tell somebody to tape their mouth if they have not addressed the ability to breathe? It can be very risky. And I think this is where that polarity happens, Nishi, that you see a lot of health practitioners advocating for mouth taping, and you'll also see those who are immersed in the world of sleep, some sleep physicians talking about how dangerous that can be if somebody hasn't been assessed for blockages. So I think that's where this polarity happens. And the way we bring that synergy is to understand that we need to first find out why is that person not breathing through through their nose. So it's not as simple as a one practice to force them to do that. So I think that's where the whole picture is required. So smell, I looked at it more in terms of the science of nose breathing, mouth breathing, how excess kapha can cause sleep apnea. Then, when it comes to touch, I just looked at it as something where there's this compound called histamine, where functional medicine talks a lot about how there are histamine receptors in the brain, which, when somebody has excess histamine or histamine intolerance, where they can't shunt out histamine after it's been used by the body, it can cause sleep disruption, particularly in the night, where in a particular window where histamine release. I think that when somebody has these challenges, just giving them a sleeping pill won't cut it. And also, I explore the seesaw relationship between oxytocin and cortisol, because touch is a way where we can use that. Like massage has clearly shown that oiling the body lowers cortisol and boosts oxytocin. I don't think we have time probably to go through all the senses. I don't know, you tell me, and we can go further or we can move on.
No, this is so helpful. Yeah, if you have time, let's keep going. And because I think the reason I'd like to share more about this is that this is a really unique approach. I've not seen this sort of approach to sleep before, and it's truly integrative. And I haven't seen it laid out in this type of a 10-step protocol. So I think this is really helpful, both for anyone who's listening who's struggling with sleep issues and for the practitioners, just to start thinking about sleep and the body in a little bit of a different way, but that's very actionable.
I think that's good, Nishi. And I must tell you that when the book was read by a few sleep physicians in India, I think it was such new information for them, because they've never understood concepts like histamine. So, why I'm saying that is not just to say that it's better than their practice or anything like that. Why I say that is that new concepts take time for us to digest and utilize. So it's not as simple as somebody might read the book and tomorrow go out and try them out. They're for sure going to have a moment of pausing and sitting with themselves. Some will be utilized, some may not. But yeah, so coming back to the senses, the fifth sense, of course, the sense of taste, which is a very key one. And I was looking at it as several aspects. One is that there's a lot in functional medicine about how bitter taste in the mouth, or the inability to taste food, or children being picky eaters is related to zinc deficiency. And there's a big connection between zinc deficiency and sleep challenges. And vegans and vegetarians are at risk for having zinc deficiency, because a lot of vegans, especially, not so much vegetarian, because a lot of the vegan diets can be a little high in copper, and zinc and copper have an antagonistic relationship. Also, Nishi, we've got this old where we use copper bottles in India, and it's become a fad today where people are carrying it all around and drinking from it all day long. That was not how it was done traditionally. You would leave it out and then you would not store it in that the entire day. Now, taking this amount of copper can make somebody zinc deficient. So at times when I see someone carrying a copper bottle, I always feel I have to tell them be cautious with that. So there's so much that when we take something from ancient wisdom and we apply it in a way that it was not being done back then, we are at risk for creating problems from that practice, and then it ends up that the world blames the practice itself. So there's that little nuance over there as well. But in taste, I also explained a lot about the right diet. For example, we know sleep challenges are related to excess vata, and vata doesn't like something cold and dry. So if somebody is having severe sleep challenges, they're not going to be able to tolerate cold smoothies and salads, because that's going to tip them into further excess vata, where then you'll hear them say that they've got anxiety. So it's important that we open our mind to these. Just because there's something that this is healthy may not mean it works for you. So if your body clearly tells you when you start eating something that I don't like this, I'm used to what you gave me before, listen to your body. And that's where I feel it's important to create synergy also between anything that is well researched, evidence based, and listening to the cues of your body, that intuition that comes from within. You may have something validating a practice, but if your body is telling you I don't like this, you need to listen to that. This next five senses, the sense of detoxification, is extremely important because we see that those with liver challenges experience sleep disruption. Research is showing that those with severe liver challenges have trouble falling asleep, maintaining sleep. So the liver is a biggest organ of detoxification. If it's compromised or bile is not flowing smoothly, then what happens is that somebody could have the inability to shunt out estrogen, which means they can be estrogen dominant, have hot flashes, which impact sleep. They can have the inability to shunt out histamine, which means that they can have trouble sleeping. They can have the inability to shunt out cortisol and adrenaline after a period of stress, so they remain in predominant fight or flight. And I also put down a little bit about genetics in that section of the book, where I spoke about one gene, which is the COMT, or catecholamine methyltransferase gene, which where people with that gene variation have difficulty detoxifying catecholamines, which are the adrenaline, anything that. So imagine somebody in that sort of a genetic state, they have this period of high stress, but after the stress they can't shunt out those hormones. They're going to remain in that emergency panic mode, and then they're going to have anxiety and sleeplessness. So I spoke a lot about that. Then in the sense of the genital, I spoke about how urinary challenges, women with urinary incontinence, constantly waking up through the night to use the restroom, how can you maintain sleep? Similarly, men with prostate challenges who have to keep waking up, we know there is a lot of research to show the connection between urinary challenges and sleep challenges, although they've not quite pinpointed which creates the other or whether it's bidirectional. And of course, when we have certain hormones, why do we have menopause related sleep challenges? Is because women suddenly are crashing progesterone and they're becoming a naturally estrogen dominant state. Progesterone is required to help the brain release GABA, which we know plays a role in sleep. Testosterone levels dropping in both men and women. Testosterone plays a role in bladder health. So there's so much connection around that. And then we have three more senses. So I'm going to do that quickly because I know we're short on time. So one is the sense of locomotion. And I use that to explore the connection between exercise and sleep. Two connections over there. The first is that exercise does help to release BDNF, or brain derived neurotropic factor, which plays a role in slow wave sleep. The second is that most exercise first increase core body temperature, and then the body attempts to restore homeostasis. Post exercise, we have a drop in core body temperature, which then allows us to fall asleep. And then the hands, I'm just going to talk about one connection there. I explored the sense of grasping in the connection of pain sleep. First, of course, there is a lot of research to indicate how pain and sleep share a bidirectional axis, both impacting the other. But the main thing to take away from an Ayurvedic perspective is that high pain is caused by high vata and sleeplessness is caused by high vata. So, pain can be an indicator of the present state of imbalance in that person. If someone has persistent chronic pain, it can be a sign of vata imbalance. So, unless you calm the vata as a whole, they won't be able to improve their sleep. And final sense, I spoke about speech and thyroid, and there's enough research showing connections between thyroid health and sleep, and there's a lot over there. So I think I'll stop with that in terms of the senses.
Thank you so much for that overview. And it really puts into perspective all of these different aspects that we can address as practitioners with our patients. There's so many different things to explore. And you've just explained it so nicely that to make it, it's really easy to understand just how you explained it and then also how you write about it in the book. What are some takeaways you would recommend to any practitioners who are listening and who maybe don't have any experience with Ayurveda? What can they take away, or what would you recommend to them as some next steps?
I think, Nishi, that first I would say just be open to trying some practices on patients, because things like yoga nidra and massage, you don't need to really be waiting for perfect evidence over there. There is, as I said, the word may not be Ayurvedic, Abhyanga, the research may show it as oil massage. So we have to sift out that information. But if somebody doesn't know much about Ayurveda, keep in mind that everybody with sleep challenges has some level of Vata imbalance. When we say Vata, we mean we're talking about the state where the autonomic nervous system is imbalanced and skewed towards the sympathetic dominant fight or flight state. That is what is high Vata. So that there are connections there, that high cortisol and high vata create very similar symptoms. So keep that in mind, and everybody can benefit from calming down vata. Even if you are really somebody who needs evidence to validate the practice before you want to try it out, or maybe your patients require you to say this is evidence based, whatever the case may be, that start with practices which are have some level of evidence behind them, which I would say the top two are oil massage and yoga nidra. The both of them, oil massage, if you combine oil massage and yoga nidra, and tell you how to do that, is that keep in mind in high vata we have a lot of air, we don't have grounding of the nervous system. So if you apply warm oil and lie down on a mat in shavasana, where you give a large ground beneath the body and give yourself. So I recommend you put on oil and play a yoga nidra and then lie there for an hour. That's a very powerful way that almost by the evening the person's nervous system is several times improved. I think begin with places like that. There's a lot of research to validate breath work. Again, they may not be very specific to anuloma viloma pranayama, but breath and sleep we do know is a very powerful connection. We know that anybody who, when we look at breath, we have to remember two key principles. The first is that the ability to relax under pressure or vagal tone where the exhale is considerably longer than the inhale is key. So many of the smart watches have the breath apps, but the inhale and exhale are the same length, and that doesn't allow somebody to slow down the nervous system. All I tell people is lie down on the ground, put a 1 kg bag of rice on your belly, and then when you inhale, try to push the bag up by counting in your mind 4 counts for the inhale, 8 counts for the exhale. You may not be there on the very first day, maybe a 4 and 5, 4 and 6, but work towards getting your exhale to double the time of the inhale, which will improve vagal tone and your ability to relax under pressure, which means you have a greater resilience to stress as they come up around you. The second aspect is when it comes to nose breathing versus mouth breathing. If you do have a lot of sinus congestion that's preventing you from breathing through your nose, first get that assessed and look at the system as a whole. Try to do practices like Jalneti and Nasyam, which even if there might not be a lot of research into them, there are a few, and there's no harm in everybody doing Jalneti and a Nasyam oil, which is you can get online as Anutailam, because it opens up the channels in the neck and the head, which means you'll have better ability to breathe through your nose. So I think these sort of practices anybody could begin with. And there are more complex practices which I described, like Karnapurna, oiling the ear canal, but obviously those are going to take a long time before research catches up, at least in terms of a sleep connection. You might not agree that an Ayurvedic text is talking about it as an improving sleep tool, but I would say if you're somebody for whom that matters, start in all these areas: oil massage, yoga nidra, breath work, and using breath the correct. That's a great place to begin. And of course, no harm looking at the food and that whole section on taste, which I wrote about, that calm vata by just favoring warm cooked food. No matter where in the world you are, whatever is your cuisine, just favor eating cooked food over raw foods, and you'll make a world of difference.
Incredible. That's so helpful. And I think you've also really highlighted that many of these practices from Ayurveda now in modern medicine or Western medicine, we might call it mindfulness, we might call it breath work. These are ancient practices that anyone can do, like you said. And I'm glad you highlighted the breathing practice where the exhalation is longer than the inhalation. So for my patients who have anxiety and they tell me, oh, I tried breath work and it made me more anxious, let's try this. Let's try focusing on the longer exhalation, and that usually does the trick. And then, even as you were saying about the foods, we can think of excess vata as hyperarousal in the Western sense. And I've seen this practice that you just mentioned of just switching to warm cooked foods, moist foods, have such an impact on patients' anxiety levels. Their digestion is better. They just feel calmer and more grounded. So these are simple things that are very low risk that you as practitioners you can recommend to any patient.
Absolutely. And I think we need more people like you, Nishi, whose training has been in the world of science and sleep science, but who are open and take an integrative approach, and who are then becoming the warriors to allow more people immersed in sleep research and sleep physicians to embrace these practices, because I think we can give so much to our patients when we use the integrative approach.
Thank you, Deepa. As we wind down, who would you recommend should read this book, whether they're a practitioner or a patient? Who do you think would really resonate with your book?
I think, Nishi, as I mentioned, when I only got that aha moment when some of these sleep physicians in a hospital read a book and they said to me, we passed it around and all of us read the book. So I did write it with the intention that everybody will benefit from it. So there are practices you can utilize from the comfort of your own home. So if you're a patient or client and you just want to start by empowering yourself, there's a lot in the book, but there's also a lot of information for sleep physicians, but I think that comes with the aspect, if somebody is open to those approaches, then there's a lot of new information. I'll be honest, not all of us know everything about every field. For me, it's always about when I come across of something, information that is different from what I know or new to me, I always come at it with a feeling of the empty glass and just learning more from it, and then sitting with it and seeing what applies to me and what can I utilize from that. So I think it all comes back to, is our glass empty or overflowing, because we need to be able to the whole thing about we can only learn if we open ourselves up. But I wrote it with the perspective that it should benefit everybody.
Thank you so much for coming on. I've learned so much from our conversation today and from the book, so I highly recommend to everyone to check it out, especially if you're working with patients who have sleep issues or if you're struggling with sleep issues yourself. I'll put the link to the book in the video description below. And thank you again, Deepa, for coming on and sharing your wisdom and knowledge.
It's my pleasure, Nishi. Thank you so much for the great work that you do.